Next speaker, Dr. John Cosby. So, excuse me. Apologize, I was jumping ahead. Our next speaker is Dr. Stephen Zodkoy, who's going to be speaking on the mind-body relationship, the answer to today's health crisis. Dr. Zodkoy is a chiropractor, a nutritionist, a researcher, and a well-published author. He's a leader in using the mind-body relationship to treat chronic and acute health conditions. He has developed a resiliency program using nutrition and mind-body medicine approach to help our U.S. veterans with PTSD, anxiety, and depressions. And this resiliency program has now become one of the largest programs in the U.S. focusing on mind-body work for our veterans. His primary practice is in Freehold, New Jersey, and he has affiliate offices throughout the Northeast. And is the author of the best-selling book, Misdiagnosed, the Adrenal Fatigue Link. Dr. Zodkoy.
Good morning. Thanks for all being here. I'm going to need a volunteer. Who wants their psyche probed into? All right, so what I want to look for is somebody who has a chronic shoulder problem, but also tends to feel a lot of stress and anxiety. Anybody? Gentleman in the back. Come on up. Let's give him a big round of applause. Not many people want to get up on stage and quack like a duck, but it's great that he's willing to. So I put this slide up, mostly because I wanted to show my book, because in 6th grade, Miss Henderson told me I could never write anything and I'd never go anywhere. So I wanted to show her that I got somewhere. The other thing is that I was a chiropractor, and that was my introduction into the mind-body. But part of what I realized it wasn't enough. So I started to do nutrition and realized that also helped with the mind-body. Applied kinesiology really brought it all together, because applied kinesiology is a way to look at the mind, the body, and the biochemistry and have them interact in an organized manner so that you can bring along total healing. I started to do research so that I could prove my ideas are worthy and correct, and then wrote a book to make some money. One of the biggest problems we have with bringing spirituality into medicine is that it's so foreign to the general public. They are so used to physicians being in total control, drug companies recommending medications, and them just sitting back and expecting healing to occur. Well, that worked in the past. This is a chart of what people died from 100 years ago and what they die from now. And in the past, it was infections, chronic infections that would kill the majority of people. So you could take an antibiotic, you could learn to wash your hands, you could take an antiviral, and it would save a huge amount of lives. The problem is we've gotten to a point where we're really having not diseases kill us so much, but functional medicine, where we're actually, dysfunction, where our bodies are no longer functioning at 100%. So we're living longer, but we've lost the quality of life. And so what we need to do is find steps to integrate so that patients learn how to take control for themselves. And one of the things I do in my office is neuroemotional technique and nutrition. I'm going to demonstrate how the neuroemotional technique works, because it's a hands-on technique that involves acupressure points, but it allows the patient to start to realize that their mind is involved with their health. And then it's a good way to move them forward towards spiritualism. It's also a good way we do nutrition, because it starts to give them control over their health. Let them start to realize what they eat affects their health. Switching from soda and coffee to water and juices is a step in the right direction. We want to give control back to the patients, but we have to show them how to do it, and it has to be done incremental. So what I'm going to do today is I want to do a quick demonstration and show you how I do the NET. Come on up, sir. What's that?
So this is to prevent me from moving my shoulder any higher than this.
How come?
Because I've had a shoulder injury for the past year that I've tried multiple
Therapies?
approaches to try.
I'm either going to look really, really good or like a total fool up here. Can you take that off?
Yeah. This is one of the things that they gave me.
Nice. All right, so let's take your arm and let's just bring it straight out like this.
That's where it goes.
That's as far as it goes? Oh, wow. I picked myself a winner. That's it, huh?
That's it.
All right. So we're going to assume this has caused you quite a bit of stress and
me to hold this
anxiety.
here?
No, it's all right. Can you hold it there?
Has this caused me stress and anxiety?
Yes.
It's one way to put it. Yeah.
There we go. All right.
I
So
would say so.
what I'm going to do is demonstrate how we do neural emotional technique. Now, it's not going to solve his whole shoulder problem, but we should be able to get him a little bit more range of motion. And the reason is that stress, anxiety, will actually, when you have trauma, when you have physical injuries, whether they be gastrointestinal, whether it be a shoulder injury, they hold you in a locked pattern. And one of the first ways to get somebody to heal is to really work with releasing these emotional stresses. This is what we do with veterans all the time. They have traumas from combat, they have traumas from earlier on in their life. And those traumas get stuck in their mind, and then it wears down their body. So what we do is we take the trauma and we turn it into a memory that they can move on from. And over time, they'll start to heal. So we're going to see what we can do for you. So we got about not so much. All right, Britt. Just relax for a second. So the first thing we're going to do, excellent. The first thing, hello? First thing we're going to do is see if there is some emotional points attached to this. I'm going to push straight down, you push up. I'm going to push straight down, you push up. Ready? Push up. And I'm going all right, and that muscle is very, very weak. So these are just emotional points that everybody has. And this is why your grandmother always holds your head. Push up as hard as you can. Much better, correct?
Yeah.
All right, so what we know is that part of his shoulder injury is definitely related to his emotions. So what I'm going to do, and we're going to do this without the mic on, or we could do it with it on. Can you hold it? Yeah. Okay. What we're going to do is just ask him some questions and then find an acupressure point that will relieve it. And then we'll touch some other points and basically start to reset, because it's obviously not going to be done in 2 minutes up here, his emotional programming, and allow the shoulder to relax a little bit, and we should get some more range of motion. What's great about this is it's an excellent way to show the patients that their emotions, their stress, their anxiety is being locked in their body. And if they want to heal their body, they're going to have to start to address their mind. We have a population now where 10% of them are taking antidepressants, 10% are taking anti-anxiety. I don't know what percent of our population smokes, drinks, and is self-medicating. And all of this is really done because they can't control their own mind, their own body. We need to show them that they can take control, and when they do, health and happiness will follow. All right, we need to do that. We need to do this one more time. Push up as hard as you can. Okay. Hold. Push up. Excellent. So I'm just going to ask you some questions, and you don't need to say anything personal. You can just think about it.
I got nothing.
All right. So does it have something to do with you yourself? Push up. Money, family, friends. Okay. So you yourself. Excellent. Push up. Okay. What emotion? Anger, resentment, fear. Okay. So have you had a lot of fear in your life? Okay. So I want you to think about the earliest time you had fear. Age 0 to 5. Push up. Okay. Conception to birth. Age 1, push up. Age 2, age 3, age 4. Okay. So I want you to think back and why you would have had fear at age 4. Does anything come to mind?
Yeah.
Okay. So what you're going to do is all you're going to do is think about the fear you had at age 4. Ready? Push up. Think about the age, the fear you had at age 4. Think about the fear you had at age 4. Much stronger, correct?
Yep.
All right. Think about the fear you had at age 4. Push up. No strength. Think about the fear you had at age 4. Put your hand right here. You're cured. No? All right. I'll do a little more. Put this on top of your forehead. And what I want you to do now is take some very long, deep breaths and think about the fear you had at age 4. But what you want to do is you want to think about how you felt at age 4, not how you feel now 40 years thinking about it. And you want to feel the fear you had back then, and I'm going to tap some points on your neck, okay? And the reason we went back to the first time he felt fear was emotions carry forward with us. Once we feel an emotion, a traumatic emotion, whenever it comes up again, even 50 years later, what's going to happen is it's going to revert back to the first time it's trapped in your nervous system. And so you don't deal with it as a 50-year-old, you deal with it as a 4-year-old. Take some deep breaths. Think about the fear. Take deep breaths, think about the fear. And what we're doing is we're just resetting his nervous system so that every time he thinks about the fear, that it's going to take energy from this meridian and basically give him a little boost of energy so that he can get over the fear and start dealing with it as an adult. And that will allow part of his shoulder to heal. Good. You can put your arm down. All right, we're going to check again. So now, all I want you to do is really think about the fear you had as a 4-year-old. Ready? Push up. Much stronger, even without holding that point, right? All right, so let's see. You can put your thumb out like that, and just lift it straight up. This is the power that we have. And what we need to do is take it from us in this room and give it back to our patients. Now that was great, and your check is in the mail. Mind-body is becoming unbelievably popular in research. PubMed is the government's research, and you can see that the graph. You can see the graph to the right is how scaling up, and that's how much more research is being done on the mind-body. These are the alarm points. These points are 5,000 years old. The technique I use called NET was found by Scott Walker about 25 years ago, and it condensed it down so that simpletons like me in the West can do it. But it's based on Oriental and Eastern medicine, unbelievably successful. What they found is that emotions are related to acupressure points, and we could address physical, biochemical, and emotional points by tapping different reflex points. And it really brings along a healing at a much deeper level, where we're looking at the nutrition, the biochemistry of the body, the physical, and the emotional. Mind-body treatments can be used for anxiety, chronic pain, chronic fatigue, pretty much everything. It's not going to solve every problem, but it's a huge step forward. And I'm not a big advocate of saying we're not going to use drugs and surgeries, but I'd like us to see using the mind-body approach first and then backing it up with medicines. This is a graph of the work I've done with the veterans. At the beginning of a 180-day program, everybody was either moderately burned out, or severely burned out. After 180 days on my program, every single veteran had improvement. The average improvement was 80%, and every single one of them went from, at most, had mild burnout. It's a huge turnaround when you think about these men and women don't have to take medication, don't have to use the VA, and have a huge quality of life, and it only took us 180 days of using nutrition and some emotional points. We're now doing this up and down the East Coast, and we hope to go nationally within the next 6 months with 5,000 volunteer chiropractors. This is me. If you have any questions, you're welcome to email me. Thank you for your time.